do this and we'll just kind of go slow, okay? Are we on? Okay, we'll call to order the Health Committee meeting. It's September 2nd. It's 9:02 a.m. And would you call the roll, please, Amanda?
Munsterman.
Present.
Hughes.
Here.
Bard.
Yes.
Grant.
I'm ready.
Crowe.
Present. And I'll just add that we are expecting Paul and Chad here in a few minutes. They're running a little behind. Are there any public comments this morning? Oh. Let's have a motion to approve the agenda.
Sorry.
Jody and Steve, thank you. All in favor?
Aye.
Opposed, same sign? Okay. I think we'll go ahead and start with Robin's report. Oh, wait a minute, I asked for public comments. Okay, we're going to, it's agency reports, do you want to go ahead?
I can, stem those questions that have been arisen if you want in public comments.
Okay, let's identify what we're talking about here. This is the Mental Health Center has presented to us that they have a program for,
First responders, veterans, and there was one other, I want to say healthcare providers of some sort, that has grant money that they're willing to provide mental health services to veterans, first responders, and that other third contention, which it's escaping me at the moment. But my concern is the real conversation that needs to be had. What are you doing with this grant money? Because they are in turn billing VA healthcare for those veterans that have VA healthcare that are seeking mental health treatment here. There's a couple other questions that have been stemmed, like, and these are the ones that I've just thought of. What do they plan on using the money for grant money? Are they going to use it to pay for their providers? Are they going to actually go out into the community and seek out veterans or first responders or nurses and healthcare providers? Is it solely for just veterans? Is it, why would VA healthcare be billed if we've presumed that they're addressing it as being a free service to veterans? There should be no billing whatsoever. Are they capable of handling veterans that have military sexual trauma, PTSD, things of that nature? Are these in fact veterans that are helping provide these services? Because I know for a fact that I wouldn't want to be seen by somebody that's not been in my shoes.
you're saying the provider for veterans respond better to veteran
Yes,
care providers?
Yep.
Okay.
100%.
With that experience, okay.
How would you handle cases dealing with military sexual trauma or PTSD?
Okay.
Are any of your providers veterans? Is it solely for veterans? How would first responders be billed?
So basically, I think if I understand correctly, for the record, you're asking if we have grant money, why would we be billing a veteran's insurance or VA benefits?
Yes.
Okay. Those are good questions, and I have no answers because I think that has to come from Amy and the Mental Health Center.
Right.
And this is a good discussion to have. It can only help a service if we all understand how this is working and what it's gonna cover. So I guess I would propose, and if anybody has any thoughts, please speak up, that since it doesn't appear Amy's gonna be here today, is that you can contact her directly and have a conversation and then come back. But I would like to make sure that Amy's at the next meeting and have this conversation so we can make the best use of the grant money and I'll be on the same page.
Yes, and like, you know, if, like in my instances, you know, what would they be willing to do to get a veteran provider on board so that we can have that same individual that has walked the shoes that us veterans have walked in to an extent, and, you know, would they be willing to do something along those lines?
I think that'd be an excellent addition, whether it's possible or not, I don't know. But here we are, we're in the beginning stages, this is a new program, so now is the time to have these discussions.
Mhm.
So I thank you for bringing this to our attention, Jen, and, will you, or do I need to do that? Send an email to Amy and tell her we have some questions about the program in connection with the VA. And that we would, like to see her at the October meeting.
And what's the date of the next meeting so I can kind of put
It will
my,
be hold on just a second, let me find my calendar.
because
October's meeting will be on Tuesday, we meet on Tuesdays, Tuesday, October 7th.
all right. Because unfortunately, or fortunately for me, we're scheduling into October already, so we're busier than a one-legged man in a bucket. Thank you. 9 o'clock too?
It's Tuesday, October, tell me I read that right.
Second Tuesday, yeah, that's right.
Okay,
October 7
at
at
9.
9. Awesome.
Yes, ma'am. I'm doubting myself.
Here we are, it's Tuesday after a holiday.
I know, everything's a little wonky.
You know how much the grant money is?
No, and it's a mental health, they have it at the mental health
Okay.
facility. But last month, I don't know, I was here for some meeting and Jan and Paul had this discussion. Jen, not Jan. And, she was sitting out and she said, sit down, I wanna talk to you, and she wondered, she had these same questions she proposed to you, and they're good questions, because what are we doing with the grant money if we're billing the VA? I don't know. So it's a discussion that we need to have so we all understand and, you know, make the best use of the money. Okay, any other agency reports? Okay, Robin, I guess we'll go with you now.
All right, you've got your program summary in front of you, I'll go over it. For August, we had 29 temporary food inspections. Those were from West and Watsika, the Old Boys and the Old Settlers. So the temporary permits for those fairs. We had 14 water samples submitted, and those were from contractors for primarily new wells. So if you look down, or repairs on wells. Wells, new inspections, we had 7. Those again are from contractors.
But you had, when you have I see underwater samples, 2 unsatisfactory samples, what would be an example of what happened there?
If there's a certain level of bacteria, they're considered unsatisfactory, and then they have them retest after treating a well.
Okay, thanks.
It's not that unusual. It happens sometimes. And that happens a lot during the turnover in real estate when someone's buying a house, they test the well and they get an unsatisfactory sample, so then they treat the well and then they test it again.
Okay, good enough.
Yeah. If you look at West Nile surveillance, we did have 36 mosquito samples submitted. That is the project of our Purdue intern, who is now going to be our full-time employee. Actually, today's her first day. Logan Robinson, she's been doing our mosquito samples. So we've had a lot of those going. That ends on October 15th. We had 60 tobacco compliance inspections, and those are mostly done when we do the food inspections. We had 5 radon kits go out, and those were all at the Old Boys Fair. If you go on the second page, we had a lot of childhood immunizations in August. We had 75 total, and those are back to school vaccinations. We have kids up to date on their head shot at school. We had 2 animal bites, but none required treatment. We do have a suspected case of varicella, that's chickenpox. The case is staying home from school and so are their siblings. So it's not to spread it. On the third page, we did have a few tuberculosis two-steps given. Those are done for nursing students primarily. We did have a new case of tuberculosis investigated, and that was a prisoner at the jail. We had 19 hemoglobin screenings completed along with the lead screening, and those are pre-K screens that we do with Head Start. Community outreach events, we had 5 CPR trainings. We had, let's see here. Oh, these were mostly back to school events with the teachers and coaches at the different schools. So we had 5 classes of CPR running. We had 12 Narcan trainings, and those were all at our booth, our vendor booths at Old Boy Reunion. And then if you look down at the jail program, we did have 17 assessments on inmates in August. No real answer to why we had more inmates in August. I do think could answer that better than I could, but it was just up this past month. On the last page, you can see the vision and hearing screenings. We had 56 in August, and that's because school has started again, so we're starting to do those vision and hearing screenings. We did Watsika, Gilman, and Milford pre-Ks in August. And then senior services, we have 206 people on services with us, and we did start the Pearls program. This is a program where we can refer people to Pearls. It's completely free. It's a depression treatment program for senior citizens. So we met with them in July and we started referring people to that as well.
Where is that located?
They have different places throughout Kankakee County, and then they just started doing Iroquois County now. So I don't know if they have an actual location in Iroquois, but most of it is done online or over the phone. People can do on the phone treatment as well, which we really liked, so that they could call and speak with a therapist.
Great, that sounds great. Backing up to page 2, reportable communicable disease investigations. What
Yes.
is Campylobacteriosis?
It's a type of bacteria, I believe it lives in the lungs, and I think that this is the same case as we had in July. It's a man that's being treated. I'd have to ask Chelsea specifically on that one, but I believe that is our ongoing case.
Okay, all right. Curious about that. And you're having a meeting of the full board tomorrow? What,
Finance committee,
Finance committee
Yes.
at 5,
4:30 usually meets,
4:30, okay.
and that's tomorrow.
Okay, very
Yes.
good. Anything else you want to share with us?
I don't know. That's, I don't think. Any questions?
Okay. Thank you very much.
Thank you.
Paul walked in just in time. We just finished with,
Morning.
have a good day with all your meetings, Robin. We just finished with public health. Tomorrow night, 4:30, they meet with the financials, their finance committee, not ours, theirs. Jen was here and reported on, or asked her questions about the grant for first responders, veterans. Amy was not here today, so we're gonna make sure Amy's here next month. And we, talked about this is a new program and it's good that we have these discussions now for the best use of the grant money and everybody's on the same page. So, I guess we'll go on to animal control. Angie's not here today and, Jill is giving her report. So Jill? Okay, well, we have a written report.
Yeah, I can read it.
Okay, so,
So the deposit, I believe, we're running on, it's like $3,300.
Yeah,
This month is gonna be more. Lacey just finished a huge batch of mail-in registration, so that should be pretty decent deposit once I get it done later today. So Angie reported that they had a busy month, they had 71 calls. They had 14 found dogs, 8 found cats, 1 horse, 11 animal abuse calls, 3 of which were ducks in the town of Watsika, 8 loose dogs, 1 loose cow, 2 lost dogs, 1 lost cow, 1 stolen goat, 3 aggressive dog calls, 4 relinquished requests, 2 calls of an owner deceased, and 3 dogs needed picked up, 3 feral cat call issues, and 1 feral cat is loose in a person's house. 5 follow-up visits, in which they left door cards. So they had 1 dog-on-dog attack, they closed 5 of the fire reports. They had 3 bats. She reported there are 3 cats in the building currently. They have 2 that were injured. And they're currently in foster care, being nursed back to health. They have 1, that got returned to an owner. They rehomed 3. iCare took 14. 4, Paw Love took 13. Heart took 1. And 1 was so severe it was euthanized to, per the vet's recommendation. There are 6 dogs at the building, 2 which are tagged for heart pickup, and 1 has a meat for a possible foster. We have 1 dog currently in foster, 2 have been rehomed, 1 pregnant dog that was sent to Tails Humane Society, and 9 returned to owners. They do have a couple of meets scheduled for some of the dogs that they have. And just kind of to go over the livestock calls, those do get reported to us, but then we just turn around and report those to the Illinois Department of Ag.
Okay. All right. We've been working on several things. We do have, I mentioned an old, let's see, I guess we have to go in order of the agenda. So what do I have here? Fee schedule. So this is from 2010 and 2011. So they're out of date. And I guess my question is, what's reasonable in the market? And I would like Angie's input on this about, I don't have any clue what a reasonable fee is for, didn't you guys get this last month? So do any of you have any thoughts or questions regarding this?
I think our fees fine.
You think they're fine the way they are?
I don't like charging too much for registrations. We already charged enough. If we charge too much, they're not gonna
Oh.
register.
This is for, let me be clear, this is fee schedule for when we go out to villages to
Oh.
pick up.
I'm on the wrong fee schedule.
Yeah, per trip for dogs to be picked up and transported, per hour after the first hour if they have to be pursued, trapped, or prorated, per trip if the dog has gone out of the area, cannot be located at the time.
What's Kankakee County charge?
I don't know, that's what
That's what
Angie's input, and I
Yeah.
want her to
Sorry,
do this.
I have it in my office, I can send it to you.
You have Kankakee's fees? Well, that, could you send it to the committee so we can make comparisons?
Yeah.
Enough.
Huh?
But we're not there animal control. It needs to be enough to cover our costs, because we're not there animal control.
Well, that's what my feeling exactly. And while we might not have to make a huge, my thought, and share your thoughts with me, is that while we might not have to make a ton of money, a profit, we certainly need to cover our costs. And when we have mileage and vet fees, and if we have a guy out there, or a girl, a gal, and they call about a dog and it's injured and we have to spend 3 hours tracking it down or trapping and then going and getting, then that involves time and an expense, and that's not to be borne by the county but the village. So that's what the purpose of this is. So, and on the back page of that are the old fees that we had with different villages. And sometimes the mayor will say, don't come if an individual calls you, only if we call you. They want to handle it themselves, okay? So I guess we'll talk about this again next month after we have additional information.
Call out, it should be $100.
Call out fee should be $100, he
Just to
did,
show up, you got a couple hours involved.
right. Well, you know, and if you're driving to Buckley and back to Watseka, or if you're driving to Beaverville, or even down to the Wellington area, you're easily gonna burn an hour.
Oh, yeah.
So Chad thinks $100, so let's make that comparison. And that leads us into the next thing on the agenda, so we'll wanna leave fees on the agenda. These intergovernmental agreements.
That's what I'm looking at here.
I'm gonna confess, I did not get this read. I had a death and several other things going on. Did any of you have time to read it? Because I really want you guys to read this and come up with your questions.
We also need to send it to state's attorney. to have-
Exactly, but we need to work on this here. We need to see that we think that it covers every aspect. And then if there's questions, if we think that, this is the old one. And then we would get the input of the state's attorney, Angie, her input, and then the state's attorney. And then we need to send these to the villages. And then we will find out if they're willing to sign, or if they just wanna call us on a case by case as needed basis. And then we'll bill them individually, you know, for that. So, I don't know, so let's put this together. So come prepared next month to have an in-depth discussion about these things. Because this is part of getting animal control back to, you know, or back to where we were, and getting things up to speed and making sure we've got, we're covering our costs. You know, we just can't do budget work and spend. We've got to have some revenue streams that cover costs, okay? So homework, you know, I love to assign homework, people. So leave that on the agenda for next month. Okay. We don't have any policies yet. And I've begun a list, and I do want to spend some time discussing this. I've discussed with Angie all the animal, and we're gonna do something about this, we're gonna take action. That these are in the office for our employee kind of things. This goes beyond this is departmental policies, okay? So when someone's hired. Animal control shirts that identify you, simple black t-shirt, one to be provided, they can buy extras, okay? We're gonna try and do that in Iroquois County, as opposed to Amazon or someplace else. Anybody, any thoughts on that further? The other policy I have, is no civilians on calls. Closed-toed shoes, I don't think anybody should be on a call in a pair of flip-flops. If you end up in a pasture or in a ditch getting a dog that's been hit, I think that's a rather standard policy. If you're on the job, you ought to have closed-toed shoes on. We did purchase a cell phone that is an on-call phone that actually the way animal control is dispatched the same way the coroner and the deputies are. So the number you see published is for the 911 non-emergency number, I believe. And then they call on the phone to dispatch whoever is on duty for animal control. So I wanted you to know that we did that, that's in the budget. So what other policies do you think that we should, you've all worked someplace, you've had rules you had to follow in the office. What was a big one? Ideas? We've talked about this for months. We really need to get something in place.
Our policies for that office need to, align with the county, their county employees, so
Right,
everything has to go through our HR policy on that.
well,
And so what ones what policies for the county do we not have that does not,
So you're
Cover
saying
that.
review the
like, is there something there?
employee handbook?
Is there something that that office has done that is not covered by our HR policy? Because,
Yes.
I mean, that's, because everything falls under our HR policy. And then if there's, I call it the tactical side, like their job is different than their specific SOPs for their job, then what's unique to them that only applies to them? I mean, do we let anyone just jump in a highway truck, family member, and go snowplow?
No.
No. You know, that
And
would-
I think that we do have ride-alongs with the sheriff's
yes,
department.
and that's a policy.
But that's-
There's a whole policy piece, so.
That's a apples and oranges comparison
but it's a
because that's
policy.
with permission through the
Mhm.
sheriff. The other thing is we're talking about union employees with contracts versus, at-will employees.
Yeah, but HR policies is still HR policy.
Well, there's separate sections for.
Yeah, but our overall HR policy can
Well-
still cover. If we say no family members, ride-alongs, then we need to also say all employees. That would be a Quinton, because we don't wanna create separate unless there's a reason to have a separate and distinct, such as sheriff has the ride-alongs, that's a community engagement piece. But there's a whole waiver process for that one. If you wanted to allow, because she's in a animal control thing, if you wanted to allow ride-alongs for animal science students, that's an intern thing, that's a different policy. But if you're just trying to say family members aren't jumping in the car. But then the next question that we have is, being it's their personal vehicle, is if they are out and about, they're up at Beaverville and they have their family and they have their stuff in there, because I'm the bee inspector, I have my stuff with me. And they get a call, do they have to drive all the way back home? So that would be a good question for Mike, excuse me, for state's attorney, as far as what is it?
He and I had a
Yeah.
conversation about that,
Because-
and I can share that with
Yeah.
you.
Because, I can see both sides. I would rather, if she's already up in that area, or whoever in their family, I'd rather than just walk across and cover it. So, however, you could have policies in place where if you receive a call and then it's advantageous to just answer it, well, family stays in the car. Or they cannot assist, or they cannot,
Okay,
because we
so
are dealing with.
I
personal vehicle.
think, as was suggested to me, is that we get this list of policies and then it would have to be adopted by the policy and procedure and made a part thereof. Because I do believe that there are some issues that are specific to
Mhm.
animal control that might not apply to another
Yeah.
department.
No, but-
And I do still maintain that there is a difference between, we are the employer for animal control.
Mhm.
Whereas in the sheriff's department and highway department, we're still dealing with two distinct sets of
Yeah, but it-
employees, but they also, we don't set policy for, say, the sheriff's department.
Yeah, we kind of do. We have an HR
Well,
and
we
union
do have
policy
an
that we
HR,
are
but I
setting
mean, I
because
think-
they're all department heads and,
Okay,
I'm just saying it's a good, we have to be careful that we don't create a separate,
well, of course, everything we do goes through the state's attorney, and if we have, I just learned, in the past month that our insurance company does have an employment attorney available, so that's a resource
they
available
probably
to
also
us.
have guidance to help with animal control because they employ counties.
Right, and
Counties have it.
I'm getting to that, I'm
Yeah.
in,
Is Kankakee Union, their animal control, I know they have a nice vehicle.
Yeah.
They have a really nice vehicle. Can we
Okay.
get their used one?
So anyway, I would like your thoughts on other policies. I really need you guys, your input. I mean, you were
And I'm
a
not challenging
teacher,
you,
I
I'm trying to
know,
throw.
we're discussing, that's okay. You know, you were a teacher, there was a handbook, but yet there were some things like you didn't do, like, I don't know, put vodka in the coffee pot in the teacher's lunch, you know, there had to be some other rules, you know? Well, I'm exaggerating, but you know what I mean,
Yeah.
you
How
know?
many employees are we talking about?
Right now we have one full-time, a part-time, and 2 wardens. And the wardens are doing the kennel duty. And we had talked about hiring kennel workers, but as Angie explained to me, they only get paid by the call. So they're not salaried or they don't get a minimum, so they want those hours. So, you know, they can make a little money too. So the wardens are doing the kennel duty, okay? And then, there's Angie and Jake and 2 more, the wardens, okay? Well, I guess actually Jake's a warden right now, but if you're looking at your budget materials, we're asking for Jake to be made full-time. So look at your budgets, okay? And see what we're proposing. There's actually a big cut in our budget by doing that, okay?
You definitely want to make sure that they have a very defined complaint procedure policy of
We'll see.
how that goes. Because that, even with the previous, back in
Yes.
2016, we had complaints, and there was not a clear pathway for complaints to elevate up the system.
And that doesn't exist in the employee handbook?
Well, is it union or is it all employees?
Well-
That's my, that, they're still in
We're
the
back
back.
to
Yeah.
the same thing, okay. All right, so I sent you all an email, copied you on the email to Dr. Roberts. I did that yesterday afternoon. We have a list of duties for a veterinary, and I'm waiting to hear back from her, and of course, I just sent that yesterday. Do you have that? Maybe you guys didn't print it out, yeah. So the list is, just to go over it, well checks and rabies vax for dogs and cats, to euthanize severely injured or aggressive dogs and cats, to keep the licensing current and in compliance with the Illinois Department of Ag, to conduct low-cost vaccine clinics, which we would really think is a benefit to our county, if we could have a low-cost vax clinic. And to conduct low-cost microchip clinics annually, and I think 4 and 5, I think those might be required in the statute. I think, but don't quote me on that. Okay, and other situations that may occur, I proposed to her that if this would work, she wanted to see the list of what we were asking for. She wants to talk to her employer, make sure there are no conflicts. And then I proposed to her that the next step would be a sit down with Paul, myself, and perhaps, one of you from the committee to be involved in that discussion as well, to hammer out some details. So hopefully we'll hear from her shortly. We have a new form that Jill revamped for us. I think, I haven't asked Angie this, but she was there. I think she's gonna use it. I'll just pass it around. I'd like it back. In the files, when we get an animal in, it's a standardized form and a little more comprehensive, I think, than what they were doing. So we're just gonna look at using a new form. That's an Angie decision. I hope she uses it, but I'm just informing the committee. So there was a question after we asked Myron to make sure everybody was covered. As far as all aspects of liability, we talked about would there be coverage for boarding and for a groomer? We got the yes, but then we had another question. If we had a dog, high-priced show dog or cat or something like that on the premises for some reason, groomer or whatever, if, God forbid, a fire or something else like that, if there were coverage for that. So Myron's got a response from Bob Spring. He says an animal would be treated as property. So if someone's animal died, it would be property damage. However, if they euthanized it, the loss would be excluded because it was an intentional act under GL, which I think is general liability. Which leads me to more questions. If we have an animal that is injured because we had a tornado and the building is flattened and or a fire, and the animal is still alive and suffering, but a vet is advising that it be euthanized, is there coverage? So every answer I get, there's another question. So I will get with Myron. Do you guys have any other questions for Myron about the coverage?
Are you only worried about high-priced dogs?
No, I'm worried about anybody's dog,
Yeah.
but I'm thinking that would be,
I just can't imagine anybody having a high-priced dog would take it to the county groomer.
I know, but, well, actually, what we're thinking about is the groomer would use our facility, but they would rent or lease the space and come in. They wouldn't be an employee of ours. They would be operating under their own, yeah. I'm sorry, you can all,
Okay, what the groomer, would they have to carry their own liability insurance?
well, I'm sorry, you can only talk during public comment, so. Okay, so anyway, we have more questions about that, and I'm gonna ask Myron about that. So we're taking no action, we'll leave department policies on the agenda. Angie told me she's gonna get with, Robin to see about the credit debit card system and fee collection. And I think that it's pretty much everything. You guys, thoughts, input, updates? Jeff?
The animal control's website, is that,
We don't have a website, we have a Facebook page.
we have a website. We have a website, it's on the county website with a
Oh.
link to the Iroquois Animal Control website.
Okay,
Is that,
show me. I didn't know this. Hello, I'm learning.
that's the
Shelter
website?
Pro,
What is it?
Shelter Pro.
I'm just curious, I never knew it, that's okay,
You can pay fees and the
okay,
registration and stuff online.
You can?
it doesn't, it's not a mobile friendly website. So. That would be a recommendation,
What would be your recommendation?
mobile friendly. I didn't know we had a separate website, like.
So how'd you get there?
When I was looking up the fees on the county website,
So there's a link?
on animal control's portion of the county website. Right. And it's not really hyperlinked, I had to copy it,
Okay.
so
So you're saying it's not user friendly? Or not
I
mobile?
wouldn't use it, it's not you. If you have your desktop with you. It doesn't appear to be user friendly.
Do you know if it went out the door, do many people pay?
That I don't know. I'm not sure.
The treasurer's office would probably use,
I think that either Lacey or Jill gets the notification that they've paid online and then they go from there, I think.
I'm not saying it's a bad idea, I'm just.
yeah, but if we're gonna use it, then, yeah. Okay. The next thing on the agenda, Jill, do many people use that link on the website?
Yeah.
Lots?
That's how they can pay, they go on there, they can see what we have in our system. as far as their dog registration, and any information we have on their dog. They can put a picture up there, which is kind of nice, because then if we have a lost dog, we have a picture of it. And the main reason people use it is because they can pay for their registration with a credit card on there.
So do you have any idea, 20%, 40%, 50%?
Probably 25.
So I'm guessing it's not very mobile friendly, but so you need a laptop is a more friendly version?
Yeah, I mean, you can use it on your mobile, I've used it on mine.
Yeah, on mine, it doesn't Zoom, I mean, it's just not. You can do it, but it's not mobile friendly,
Right,
so
right.
I would be like, nope, too difficult.
So when you don't have anything to do, you can go check.
But I didn't know we had
You can
it.
check that out.
We've had it before I was here.
I didn't
Anita
know
got
we
it
had
set up.
either. Huh. Okay, that's good to know. Okay, anything else? Okay, I
The
entertain,
fee, sorry, Donna, the fee schedule, I had said I had one, it's the Kankakee County, it's their, disclosure form, but it has all their fees on the back. So I don't know if you guys wanna use that.
is that what I just passed around? Is that the form you redid for us?
I redid it, yeah.
And that has the village, what they charge villages.
No, I thought I had that, but I don't, I have the
Okay.
disclosure form with the fees that they have on there, there's fees on the back,
Yeah.
Oh, there is.
so.
Did I email this to you guys?
I just forwarded it to the whole committee, because
You
I was
did?
waiting to hear back from you guys,
We don't have to formally adopt this, that's within Angie's purview to use this form, and we.
I mean, I would have you guys, have a state's attorney review it, and then you can formally adopt it, yes.
Yeah, we don't have our.
Our impound fees?
As far as the fees go and the
It
intergovernmental
says
agreements,
45
yes.
slash
The
100.
disclosure form, that she can use right away, because that's just all the animal records. But if you're gonna do anything different with like the intergovernmental agreements or the fee schedule, then yes, I would say that has to go.
Oh, of
Yeah,
course,
you
but
guys.
she can just start using this form.
Yeah, the one
Because it's what we currently have.
yeah, it has our current stuff on here,
All right.
and she has been using it.
Okay, that's good to know. So any changes to our fees, of course, and the intergovernmental agreement.
Needs to be reviewed by the state's attorney once you guys are, and I sent that to everybody.
And you might have been out of the room when we said that.
Yeah, sorry,
Okay, I'll entertain a motion to go into executive session under 5 ILCS 120/2/C1. The appointment, employment, compensation, discipline, performance, or dismissal of specific employees of the public body. Thank you. Steve makes the motion.
Second.
Chad seconds. Okay. All in favor? Opposed, same sign? Okay, thank you.